I'm delighted now to be joined by Dr. Louise McCullough. Dr. McCullough, welcome.
Thank you.
Thank you very much indeed for taking the time to talk to us today. Busy schedule for you at this year's conference?
Very busy. I have a lot of students and trainees with me, so they're making the most out of the conference.
Well, that's very important, isn't it?
Very important. We're losing many of our young trainees, especially ones that have medical backgrounds as well. It's very difficult to spend your weekends writing grants that may not get funded when you can go do clinical care. So that's one of my big efforts, is to try and mentor these young people and get them involved in science.
Let's talk about one of the topics you've been talking about this week, animal models of stroke. Tell us a little bit about your sessions.
So we have two sessions. One was yesterday in the pre-conference, which I was very happy to see the AHA support, really was looking at animal modeling of disease and where we're kind of falling short. It's very frustrating to us in the clinical world as well that we can't develop effective stroke therapies. And people have been a bit disappointed with things that look very promising in animal models, but then don't translate into our population at risk. So one of the big focuses of yesterday's session was trying to figure out why that was. So my specific interest is on aging models and models using females. As we know, more females die from stroke than males now. 60% of deaths are actually in women. So we have to model that epidemiology in the lab, and we have to use old animals. But unfortunately, they're frailer, they're sicker, they have higher mortality, and they're expensive. But I think when you get to the final stages of drug development or a therapy, we really need to use appropriate animal models, and that really was the focus of yesterday's session.
So how do we bridge that particular gap?
I think realizing how important it is to use animals of both sexes, and it's difficult because they're very expensive. Even supplemented by the NIA, each mouse costs $120, $130. So I think we have to realize that we really need to recognize this is an important investment, that despite their higher cost, that they may give us better results than using an animal that's 12 weeks old, which is standard in the lab. That's equivalent to a 10 or 12-year-old human. So not that many people at that age get strokes. So I think we have to realize that it's an investment and use those models. And I think the NIH is understanding that now and is providing a lot more support.
This is an important conference, isn't it? Because the chance to meet your colleagues from literally all over the world, you can't beat that, can you?
And in fact, that is one of the biggest things. There are people I don't see all year. I may talk with on email. I may have collaborators that I write papers with that I do not set eyes on for a year. I come here, I see everybody. And it's fantastic because you get the best science, and there's enough time in the program, especially in the evenings, to build in those networking things. And again, I think that's very important for young attendees, for people who are just starting out with careers in stroke, to meet some of the leaders in the field and the leaders of the conference, and they do tend to be very approachable here. So I think that's fantastic.
Well, thank you very much indeed for talking to us.
Sure.
We really appreciate it, and I hope you have a great conference.
Thank you very much for having me.